books to alternative dietary support programs and even to sophisticated medical equipment, all are on display here. Healthcare providers showing off their capabilities to win over the huge lot of Nigerians who travel abroad to seek healthcare. Nigerian law prohibits healthcare advertising, but this has gotten a nod right from the health ministry. The grand plan is to stem unnecessary forex outflow from an economy battling a persistent dollar crisis. But it's a hard task. The country's healthcare system is weighed by a bad reputation. Doctors like Okoye are optimistic that they can change that.
So many people have gone outside the country for surgery, coming back and they are not able to get follow-up. And then it gets bad and then they have to reinvest money to get treatment. That's a whole lot. The system is not really working. So we thought there couldn't be a better time in line with the desires and the plans of the president and the need for us, the private people, to get proactive and find a way to solve the problem.
Nigeria tops the list of African countries in costly medical tourism, with costs running into billions of dollars. But that against the fact that the country is battling a persistent dollar crisis, and authorities think local capabilities showcased here could be a viable substitute for healthcare abroad. Nigerians spend to the tune of $1 billion on medical tourism annually, but the economy has been severely battered by falling oil prices. It's now officially in a recession, and the government is trying to manage forex outflow. About 47% of its medical tourists have been going to India, but the government and some of the private providers have succeeded in getting Indian health facilities here. Dr. Obajuluwa works in one of those facilities, and he now campaigns for domestic health care.
Even when you travel out, the way you will be treated by a Nigerian in your own country is not the same way you'll be treated by a foreigner in a foreign place. So back to the question at hand, I think the basic issue is just the mindset of people that if you don't travel out or if this thing is not performed by a white person, you're not going to get the best of results.
President Muhammadu Buhari's government has made a substantial increment in allocation to healthcare, but that has only increased Nigeria per capita healthcare spending to $67, while a country like South Africa spends 7 times as much on its citizens. Kelechi Emekalam, CCTV Abuja, Nigeria.